President Trump appeared on national television today and made an announcement that will raise a lot of questions. We will try our best tonight to answer them for you. The president said pregnant women should not take acetaminophen, the active ingredient in Tylenol.
That is because, the president claimed, use of Tylenol in pregnancy is linked to a rise in autism in children. Our Dr. John LaPook is here to help us understand the implications, but we begin with Ed O'Keefe at the White House. Ed?
Good evening. The president's been under enormous pressure from his health secretary, Robert F. Kennedy Jr., and the movement the secretary leads to figure out the increase in autism cases across the country in recent years. And the president said what they announced today is just the start.
President Trump today tried reversing decades of medical advice given to pregnant women.
Don't take Tylenol. There's no downside. Don't take it.
Specifically, the Food and Drug Administration is set to tell physicians that using acetaminophen, an active ingredient in Tylenol, during pregnancy can be associated with increased risk of autism, and that pregnant women should use it only in extreme circumstances.
See cases of extremely high fever that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think.
Health and Human Services Secretary Robert F. Kennedy Jr. has spent years pushing unproven theories about what causes autism.
And we will be uncompromising and relentless in our search for answers. We will perform the studies that should have been performed 25 years ago. Whatever the answer is, we will tell you what we find.
Just last month, Trump's own FDA said it has not found clear evidence that appropriate use of acetaminophen during pregnancy causes birth or development issues. The parent company of Tylenol said it's the safest pain reliever option for pregnant women. That's because ibuprofen and aspirin are already discouraged for pregnant women due to risks of miscarriage or birth defects.
What do you say to those that say what you're doing today potentially just introduces more confusion into the debate?
I think women for many years, in fact for decades, Ed, have been confused by the rapid increase in autism in this country. In the childhood epidemic, that is chronic epidemic, disease epidemic that is plaguing America's youth. Women are confused about that and they want answers to that.
Today's announcement is part of a years-long push by Kennedy to remake the nation's public health system. Democrats have called on him to resign.
Every single day there's been an action that endangers the health and wellness of American families.
While the latest CBS News polling shows a majority disapprove of the job he's doing.
And there is strong criticism of the announcement from the medical community. The head of the American College of Obstetricians and Gynecologists called it highly unsettling. The top officials, quote, are willing to make an announcement that will affect the health and well-being of millions of people without the backing of reliable data.
All right, Ed O'Keefe at the White House, thank you.
Joining us now is CBS News chief medical correspondent Dr. John LaPook. Dr. LaPook, don't take Tylenol, no downside, tough it out. The president said all three. Your reaction?
It's not a matter of toughing it out, John. I mean, you have to remember that high fever and pain during pregnancy can harm not only the pregnant woman, but the developing fetus as well. And that's why Tylenol, acetaminophen, has been used for decades.
So, should an expectant mother take Tylenol, yes or no?
Well, it's tricky, right? Because there's really no good alternative. You cannot prescribe aspirin, ibuprofen, because those have really potentially very serious side effects. And that's why the recommendations that you heard today, and also from organizations, is use the smallest possible dose for the smallest amount of days possible.
Is there a scientific basis for the link the president claimed between taking Tylenol and autism?
It's complicated because the literature is conflicted. You know, there are some studies that show there's potential link of Tylenol use during pregnancy to autism. Others say there isn't. That includes a very large study over 25 years of 2.5 million children in Sweden. And I would have loved to have seen, as in the past, we say, show your work, the data, the thinking behind all this. I would love to see it written down. I will say that I was very happy to see that there's going to be a lot of money, time, and effort that's put into the whole field of autism. We certainly need it.
Okay. Dr. LaPook, thanks so much.
CBS News medical contributor Dr. Celine Gounder joins me now. Dr. Gounder, let's just start with the basic question. Is there a proven link between prenatal use of acetaminophen and autism?
No, John. The best evidence we have does not show that Tylenol causes autism. They cherry-picked a couple studies that they thought backed their claims. They ignored the lion's share of studies that argue against Tylenol causing autism. The best recent study argues against a causal link. This is a study from Sweden looking at siblings, 2.5 million births. And when they compared siblings, so they're controlling for family genetics and other risk factors, they found no association with autism and ADHD. And I also want to note major medical organizations continue to advise that Tylenol can be used during pregnancy. These are the people who care for and about their patients. They have no political points to gain here.
What's your biggest concern then about what the president and his team said today?
The president said multiple times that there is no downside to not taking Tylenol during pregnancy, other than a mother would have to tough it out. And that's not actually correct. I worry that this will scare women and that pregnant women may avoid Tylenol even when it's entirely appropriate. So, for example, to treat a fever. Fevers and infections during pregnancy can cause neurodevelopmental disorders, including potentially autism. And guess what? Many women will take Tylenol when they have a fever or an infection, but it's not the Tylenol that's causing the problem. It's the fever or infection. Tylenol remains the go-to option during pregnancy. Other medications like aspirin and ibuprofen can cause heart and kidney abnormalities in a fetus, especially if they're taken in the third trimester. So Tylenol is your best first-line option. And the next line option for pain would be opioids.
Mm-hmm. Dr. Celine Gauner, thank you so much.
President of the American College of Obstetricians, Dr. Stephen Fleischman is here with me now. Doctor, your evaluation of what you heard the president say?
I'm a little surprised that that's the extent of the announcement, is to not take the medication unless you medically need to. I would say that's probably what we've been telling people all along. No one takes Tylenol unless it's necessary. It's not like a vitamin, and we would never treat it that way. Patients are told to use acetaminophen when they have a fever, when they have a headache, or other pain symptoms in pregnancy which require treatment. So I was hoping maybe we'd hear something a little bit more detailed, and maybe that's still to come, but I'm not surprised by that statement.
When the president says, as he did, that acetaminophen use is associated with a, quote, very increased risk of autism, would you agree or disagree with that?
I would disagree with that statement. We've been studying acetaminophen and the links to autism for over 20 years. There are numerous studies on this subject, and it is a hard thing to go from a causality, from an association to causation, right? And so I think the problem that we've had all along is that it's really hard to study something like this. Spectrum disorders like autism have a wide array of underlying causes, and we don't know all of them. We do know that there's a genetic component to it. There are probably environmental components to it. When you look at one of the largest studies done that was published last year from Sweden, which to me is a great trial, which looked at siblings who have similar genetic makeup. And so moms who took Tylenol during their pregnancy and those that didn't take it in a subsequent pregnancy in a sibling. And they showed no increased risk of autism in the offspring between the two groups. So I think that kind of study is what we're looking at as sort of gold standard science. Many of the studies that are being included in this, what we call meta-analysis, that I think they're basing much of this recommendation on. There are some studies in there that are well-designed and others that are not so well-designed. And again, it's hard to study pregnant women and a medication like this because the impact might be for many years to come. And the biggest confounding variable that comes into this is you don't take Tylenol just for fun. Everyone who's pregnant who's taking Tylenol or acetaminophen is taking it because they have a fever, they have pain. And so what you can't, associate, is it the fever that is leading to an increased risk of autism, or is it the acetaminophen that you take for the fever? And I think that's where causation is really important. And making a statement, that we've just heard, I'm not sure really helps clarify the picture.
Doctor, as you well know, one of the ways that this translates or is translated to patients alters behavior, alters perspectives, alters what people ask or wonder, well, what should I do in this particular circumstance? The president said, ideally, you don't take it at all, but you could if you, quote, can't tough it out. How do you think that's going to translate to a pregnant woman?
I think they have to really think about that statement of toughing it out. We know that fevers in early pregnancy are associated with cardiac issues, cleft lip, cleft palate, and cranial CNS abnormalities. So the idea that we're going to let someone with a fever tough it out may have much worse implications for a pregnant woman than taking a dose of acetaminophen to bring that fever down. I think that that's not really an appropriate way to handle medical issues in pregnancy.
And generally speaking, how is it defined that a pregnant woman has a fever? Is there a number?
So we generally use a fever of above 100.4. We know that higher fevers are definitely associated with more issues, but if your temperature is above 100.4, taking acetaminophen to bring that down is definitely advised.
And what's the dosage advised in that particular circumstance, Dr. Fleischman?
I think, a single extra strength dose, which is 500 milligrams, should be more than adequate and needed. If it's needed to be repeated, we do that again, but that should be fine.
Would you say that today's announcement falls in the category of more harm than good?
I do. I don't think that there's any new information. I was hoping that maybe there was some study we hadn't heard about that was getting released, but we don't hear about any new studies coming out. So based on the data that's available right now, I think that recommendation doesn't stand. And I do think that the harm of patients not taking acetaminophen is probably a concern. And more importantly, for patients who already have young children who now know that they took acetaminophen when they were pregnant maybe a year or two ago. We've increased a level of anxiety with what I would say is very poor data and really nothing that suggests that there's a clear causality between the two.
Dr. Stephen Fleischman, I appreciate your time and your expertise, sir. Thank you.
And Dr. Shoshana Ungerleider joins us now. She is a board-certified internal medicine physician, also host of the TED Health podcast. Doctor, thank you very much for joining us here. Very strong words there from President Trump. What does the totality of research out there tell us about Tylenol and autism?
Nancy, here's what we know. Decades of research show that Tylenol, also called acetaminophen, has not been found to cause autism. The strongest studies we have, including sibling comparisons, find no causal connection. A few observational studies raised questions, but when the best data controlled for things like genetics and family factors, any association there disappeared. So in other words, the science does not support this claim. And what's far riskier is leaving a fever untreated during pregnancy, which can harm both mom and baby. So Tylenol remains the safest option we have in those situations.
So what would you say to pregnant women who might be worried or confused about taking Tylenol if they're facing this and they go, what do I do now?
Yeah. So first, I would say to concerned parents or parents-to-be, you are not going to cause your child to have autism by taking Tylenol. You deserve science-based guidance and not fear-mongering. Autism is complex. No single medication explains it or fixes it. I think what matters most is making sure that children and families get the right support, educational, medical, emotional, so that kids can thrive, right? So I think knowledge is power. The good news is there's so much we can do to build a better world, more supportive world for autistic people without chasing sort of unproven cures. So I would say to pregnant people, I would follow the advice of your doctor.
And Dr. Ungerleider, the FDA is also approving a different drug to be used as a treatment for autism symptoms. What can you tell us about that drug? And is there research out there that shows its effectiveness?
Yeah, so this is called leucovorin or folinic acid. It's actually a prescription drug, not a vitamin supplement. It's used in chemotherapy and for certain rare metabolic conditions. There have been some studies where it's been tested in children with autism, but there have not been large, rigorous trials proving that it works. It has been shown to improve language, communication, and some behavioral symptoms in certain children with autism, particularly those with folate receptor autoantibodies or folate pathway dysfunction, but it's not universally effective, and larger trials really are needed before it can be considered a standard treatment.
Dr. Shoshana Ungerleider, thank you very much for joining us tonight to talk about all this.
We begin tonight at the White House, where President Donald Trump held a press conference focused on autism. During his remarks, he suggested a possible link between the use of acetaminophen during pregnancy and an increased risk of autism in children. Today, I spoke with the co-author of a study published last month in the journal Environmental Health. Now, the research linked prenatal use of acetaminophen to an increased incidence of disorders from autism and ADHD. But today, Dr. Ann Bauer stressed to me that the link she found requires a lot more research.
The risks that we identified were modest, particularly for short-term use. When we see the highest risk is for people who use it for an extended period of time. So I don't think that mothers should get hysterical if they're pregnant and have used it for a day or here or there. But they should not be using it as the first line of defense of any minor discomfort that they experience. They should be trying to use non-pharmaceutical interventions first. But it has its time and its place. While we strongly support precaution and warning pregnant women about the use of acetaminophen during pregnancy for things like nuisance pain and mild discomfort, acetaminophen is really one of the only tools we have for pregnant women. They are not allowed to use ibuprofen or aspirin during pregnancy. And things like high fever and extreme pain can cause severe outcomes and harm fetal development. Now, there should be a discussion between a woman and her physician before she takes it. But I think doctors are afraid to have even mentioned this in the past because they don't want to lose this tool in their toolbox. And it's a very nuanced statement that sometimes you still will need to use this medication.
Now, also during that press conference with President Trump and his top health advisors, he said that he's a big believer in vaccines. But today he also claimed, without citing concrete evidence, that giving vaccines close together at the recommended ages could also be linked to autism. So I also asked Dr. Bauer for her reaction on that. Take a listen.
The question about vaccines and autism has been asked and answered. There have been between 20 and 30 case control studies and cohort studies, and we've never seen a signal. This question has been asked and answered. It's been the vaccine link has been debunked. I don't understand exactly why he's gone there. I know Robert Kennedy thinks otherwise, but the science says there's no link.
All right, I want to bring in Dr. Veronica Gillespie-Bell, Vice Chair on the Committee for Practicing Guidelines for the American College of Obstetricians and Gynecologists. Dr. Gillespie-Bell, thank you for being with us. What does the ACOG have to say about the use of acetaminophen during pregnancy?
So ACOG maintains that Tylenol or acetaminophen is safe in pregnancy when it is used as directed. As always, we want our patients to consult with their healthcare provider before using any medications, but all of the data shows that it's safe, and there is no data that shows Tylenol causes autism.
So President Trump also said there's no reason to vaccinate newborns against hepatitis B, saying this is a sexually transmitted disease. So why is that vaccine part of the current vaccine schedule for babies and newborns?
So actually, the highest rate of transmission is from mothers transmitting it to their babies during birth. And so that is the reason that we give the vaccine. We do try to test moms for hepatitis B to see if they are carrying the antigen, but really the best treatment or the best prevention for babies is to provide that vaccination.
And are there any serious side effects that newborns have experienced from having the hepatitis B vaccine so early in their life, almost right after birth?
There's no data that shows that there's any side effects or any long-term consequences of providing the vaccine at that point.
I can only imagine how difficult it would be for a pregnant woman right now who's getting all of this information. And as somebody who has had 2 babies, it's a very emotional time. It can be a very scary time, and you want to do what's best for your baby's health and also your own health. And there's a lot of fear and mistrust of medicine right now because of all this conflicting information. How can doctors help patients navigate these confusing health guidelines like these are?
Yes, I know it has to be very confusing to our parents, to our moms out there, to their family members that are loving them and supporting them with all of this data coming out. Really, we want our patients to always seek their advice from their healthcare provider, and we really want providers to rely on the science. And again, the American College of Obstetricians and Gynecologists, as well as the Society of Maternal Fetal Medicine, has released guidance and recommendations to remind us that all of the data shows that Tylenol is safe in pregnancy. It does not cause autism. And we have to remember, we're usually recommending Tylenol for conditions like fever. As was stated earlier, we don't have an alternative medication for treating fever. And we know that when someone has fever, and it's not treated, especially in the first trimester, that can lead to birth defects. And so we really want our patients to rely on our providers, and we want our providers to rely on the recommendations from ACOG and the Society of Maternal Fetal Medicine.
You know, RFK Jr. and Donald Trump both said that their goal was by September to have some real information on what causes autism. Autism has been studied for many, many decades. Have doctors really come to any kind of conclusion of what causes autism and why it seems like more children are developing the condition?
So we all would love to find the answer for what is causing autism. One of the concerns, one of the issues is that it's multifactorial. It's neurodevelopment, it comes from neurodevelopment, and there are multiple factors that contribute to that. So that makes it really difficult to find the one thing that causes autism. And yes, the rates of autism have increased, but also so have our ability to detect autism and our ability to recognize it and test. And so it's hard, it's difficult to say, are we having more cases because there are more cases, or are we having more cases because we are redefining and we're doing a better job of diagnosing and starting treatment early?
Are you concerned? The president said that there's going to be a warning label placed on acetaminophen and Tylenol, saying that there could be a link between using this in pregnancy and autism. Does that concern you or worry you that there might be pregnant women out there that may have a high fever or extreme pain that would be nervous to take anything?
Yes, I am very concerned. When you see that on a label as a pregnant mom, as you said, we all are trying to do what's best for our babies. And so I think it will make our moms scared to take Tylenol, and the repercussions, again, for those moms that are having fever and those moms that are having pain, those repercussions can be very detrimental. And it's really shameful when we know that Tylenol is safe. And again, we have no studies showing that it causes autism.
Dr. Veronica Gillespie-Bell, thank you so much. Great to see you.
Thank you. My pleasure.